Welcome. My name is Ellen Barra, and I'm with the WPS Government Health Administrators Provider Outreach and Education Department. We want to discuss Assistant at Surgery Services, and specifically those surgical procedure codes with a 0 Assistant Surgery Payment Indicator in column U of the CMS Medicare Physician Fee Schedule Relative Value File, also called the database. We'll show you how to get to the database file in just a moment. A 0 payment indicator means Medicare only reimburses an assistant surgeon when the specific patient situation or condition requires the assistant. Submit documentation with your claim to support billing for an assistant at surgery. The operative report would be the most common type of documentation. The operative report would show the medical reason for the assistant and the activities of the assistant. The patient's medical record may also contain information to support the medical necessity of the assistant. In the description of this video, we have a URL for an article on our website titled Additional Documentation: Ways to Reduce Your Burden. One of the items in this article is the use of the PWK segment on your electronic claims to let us know you have the needed documentation. Correctly using the PWK segment will prevent you from having to wait to receive an additional documentation request or ADR letter asking for your documentation. The description of this video has the URL to the CMS webpage to access the database. This is so you can determine the payment indicator for the surgical procedure code. What you see on your screen is the database files. Choose the file applicable to your date of service. This is divided into quarters. For example, the file RVU21B is for the second quarter of 2021. This is a zipped file. When open, there are two additional files you will want to open. The first is the actual database. This is the largest Excel file in the list. This shows column U for the Assistant at Surgery indicator. As you can see on this page, there are 3 of the 4 indicators. The 0 payment indicator means documentation must support the medical necessity of the assistant at surgery. There are other payment indicators I'll explain in a moment. The second is a PDF document that provides the explanation of all of the columns on the database. There are 4 indicators under the Assistant at Surgery column in the database. What you see on your screen is the definitions of the indicators from the PDF file. You can see the 0 payment indicator means you must submit documentation before Medicare can make payment. The 1 payment indicator means that Medicare does not pay for assistant at surgery. The 2 payment indicator means Medicare reimburses for an assistant at surgery. The other payment indicator 9 means the concept does not apply. The procedure code would not indicate a surgery. We suggest you perform a self-audit for those situations where you submitted charges for an assistant surgeon. Verify the assistant surgery payment indicator. If billing an assistant surgeon for a 0 payment indicator procedure code, verify your documentation supports the medical necessity of the assistant and identifies the specific services provided by that assistant. If your review does not support Medicare payment for an assistant surgeon, please refund any amounts back to Medicare. Thank you for your time. If you found this information helpful, please like and share it. If you do not already, please subscribe to the WPS YouTube channel to receive notifications when we publish new material.